Hi everyone, I'm Dr. Megha. I'm basically the emergency medicine consultant over here in Indra Gandhi Co-operative Hospital, Kadwantara. Today I'm going to talk on the topic called seizure. What do you do, first aid in seizure? So basically first you need to know what is seizure. So seizure is basically, you have electrical activities in brain, a burst of electrical activities in brain. That what happens is patient, due to that there's a temporary damage to the brain tissues, and during that what happens, patients abnormal behavior, abnormal movements, and there are even chances of abnormal state of awareness. So what we do in the seizure cases, so when you get a patient with seizure, you first need to stay calm and you need to stay with the patient. That is what is the first thing you're supposed to do. After that, you need to, if there's a medical tag or the patient has, like in India right now, we know usually if, you'll be checking into the purse. So if probably they have something, any known medications or something they're taking, we can get to know about it. And then the second step, what is the second step? There is a scene safety. So we need to know whether there's any harmful substance around the patient. We need to relocate that. We need to make the person in a better place, the patient. What's the third step? Okay, the third step is basically you need to protect the airways. So what you're supposed to do, you need to make the patient lie in one left lateral position or so that the patient doesn't have any tongue fall, or even you can prevent the aspiration part. Okay, now what's the fourth step? Fourth step is you should not give any water or pills or any other food substance to the patient. You need to be careful of it. Now, what about the fifth step? The fifth step is basically you need to, there's one point that you should not restrain the patient. Okay, if you restrain the patient, you are not going to do anything good. You are going to harm the patient even more. Coming to the sixth part is like you need to be with the patient in this active seizures. Basically, you're looking whether the seizure is, how much time it's actually lasting. It's within 5 minutes or it's prolonging. If it's within 5 minutes, the patient would be in front of you alert, and then you can do the necessary steps. But suppose if it's extending more than 5 minutes, then what you need to do is you need to activate the emergency medical team. Okay, there are even other conditions where you need to activate. That is, if the patient is pregnant, if the patient is sick, or there are any other issues, like suppose the seizure activity took place in the water, or the patient was having any other like unconsciousness or breathing difficulty, or some other major problems like injury or other things. I would like everyone to know these first aid steps, because this is done outside the hospital. Okay, by the time you get the patient inside the hospital, we are there to support you. We are from the Indra Gandhi Co-operative Hospital, Kadwantara. We are the emergency medical team here to help you and serve you. Thank you.